So since when I last reported a week ago, actually 8 days ago on March 30th, we've since had a substantial increase in the number of cases. So we're now up to 8,208 cases, up 560 over a week. And this is essentially a 44% increase over week on week. So if you look at the week beginning on the 28th of March, that week we had 444 cases. The week before that, we had 308 cases. So that's really quite a large jump. If you go back over the preceding weeks, we had a bit of a sawtooth pattern of cases going up and down, but not nearly to the extent that we've seen in the past week. So this is really quite significant. We also have had an increase in our active cases. We have 678 active cases right now, which is up from 459 a week ago. We've had in total 205 individuals who've passed away from COVID-19, and this is up by 7 over the past week. I would like to express my condolences to the family members who've lost these people. I would like to express my sorrow for your loss. So they consist of the following people: a man between the ages of 65 and 79 from Simcoe County, a woman between the ages of 45 and 64 from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, a man between 80 and above from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, a woman 80 and above from Simcoe County, and a man between the ages of 65 and 79 from Simcoe County. We've presently got 41 individuals from Simcoe County or Muskoka who are hospitalized, and this is up from 32 a week ago, including 13 in the intensive care unit, up from 9 a week ago. And actually, this is the largest number of people we've ever had in intensive care from COVID-19 from Simcoe, Muskoka in any one period of time. This is the highest number that we've had. Their ages range, in terms of those hospitalized, their ages range between 30 and above 80. 23 of them are sporadic cases. 18 of them are related to outbreaks. In terms of those in the intensive care unit, they are younger in age than before. So from January of this year to the present, 36% of the ICU cases have been under the age of 60, compared with 13% of those during the months of October to December of last year. So we've seen not only an increase in the number of people in the intensive care unit, but they're also younger people. Perhaps to some degree, we're having some success through immunization of older people in avoiding their admission to the intensive care unit. But overall, with the larger numbers overall, I think this speaks to the increased severity of the variants of concern that are now dominant in their impact on younger people. So we are seeing younger people being more impacted with the present wave. So in March, the average age of confirmed cases was 37 years of age, and in February it was 38 years of age, and in January it was 43 years of age. And certainly in part due to the impact of large institutional outbreaks that we were having at that time. We've had a total of 84 cases reported in the last 24 hours. So that's a large number of cases in a single day. They're all sporadic cases, none of them associated with a facility outbreak. 42 are male, 42 are female. Half of them are under the age of 35. 82 of them reside in Simcoe County and 2 in Muskoka. 4 of them were acquired in the community, which means we don't know how they acquired it. 2 were close contacts of other cases, and 78 are under investigation. 81 of them are self-isolating, 2 are hospitalized, and 1 has recovered. So the vast majority of our active COVID cases in Simcoe, Muskoka reside in our southern portion of Simcoe County. So Barrie, Bradford, West Gwillimbury, New Tecumseh, and Innisfil. And the following lower tier municipalities or single tier municipalities have had the highest incidence of cases per 100,000 population over a week period of time. So Bradford, West Gwillimbury at 221, which is up from 165 a week ago. And it's close to the highest number they've ever had, which was 233 during the week of January the 3rd. Collingwood now has a very high incidence of cases at 121 cases per 100,000 population. And this is up from 29 cases per 100,000 population over the week that preceded last week. And this is the highest that they've had since the beginning of the pandemic. New Tecumseh, 162 cases per 100,000 population over the past week, up from 104 the week before. And that is the highest they've had since the beginning of the pandemic. Barrie has 87 cases per 100,000 population, which is up from 72 cases per 100,000 population. That's not their highest that they've ever had. And Innisfil has 118 cases per 100,000 population, compared with 61 cases in the past week. So this too is the highest that they've ever had since the beginning of the pandemic. Certainly there's a lot of attention on educational settings, schools, and childcare centers. So at this point, since February the 8th, when the schools are reopened, we've had a cumulative total of 271 individuals who had been in the school environment with COVID-19. So that's not the same thing as transmission in the school environment. The great majority of these cases actually acquired their infection out of school, in the community, or in their household. But nevertheless, that resulted in exposure to others. And this is up from 163 cases a week ago. They could be either staff or students. This is sorry, just having a look here. The total number of cases in school settings. So the figure that I just gave you was educational settings, which is both school settings and childcare settings. So in school settings, the cumulative total has been 192 cases since February the 8th, which is up from 152. And is, as indicated, these can be staff or students. 80% of those have been in elementary schools and 20% in secondary schools. And at present, we have 4 outbreaks in schools. So as I said, the great majority of these cases or exposures have not resulted in outbreaks. And we have had a total of 19 cases in childcare settings, staff or the students, which is up from 11 a week ago. In terms of the variants of concern of COVID-19, we now have had a total of 1,525, which is up from 1,232 a week ago. And 97% of those have occurred in people living in Simcoe County, 3% in the district of Muskoka. And so far this week, 85% of all of our COVID cases have tested positive for being a variant of concern. So that is an upward trajectory. It had been 77% during the week of March 28th. And we have 11 active outbreaks of variants of concern, up from 6 a week ago, all located in Simcoe County. 3 of them are in workplaces, 5 of them educational settings, 1 a congregate setting, 1 a community setting, and 1 an institutional setting. The great majority of our cases have been from the B117 variant, originally identified in the UK. However, we have 2 outbreaks that are found to have screening test results suggesting that they are one of the other variants of concern, not the B117. So we're awaiting further determination as to exactly which variant they are. If we look at all of our outbreaks, we are now up to 19 outbreaks at this time, compared with 12 the week before. And as I'd indicated before, 11 of these outbreaks are from VOCs, variants of concern. So 7 of our outbreaks are in institutional settings, up from 4 a week ago. So 5 are as follows, 5 new ones. There's an outbreak at RBH in the cardiac and renal unit, also at Woods Park Long-Term Care Facility, Victoria Village Manor, the Eldon and Bradford Retirement Home, and the Waterford Retirement Residence. And the outbreak that had been at CNCC is now declared over. We have 1 outbreaking in a congregate setting, which is unchanged. We have 3 outbreaks in workplaces, which is unchanged in total, but 1 of them is new, emergency services in Simcoe County, and 1 is declared over, a manufacturing facility in Simcoe County. We have 2 outbreaks in community settings, up from 0 last week. So the 2 are new. 1, a real estate, I guess 2 of them are actually real estate, rental, and lease locations in Simcoe County. And we have 6 educational settings in outbreak, up from 4, so 4 new ones. A child care center in Simcoe County, the Good Shepherd Public School in Barrie, WH Day Elementary School in Bradford, a school in Barrie, and a child care center in Simcoe County, and 2 that are declared over, Andrew Hunter Elementary School and a child care center in Simcoe County. In terms of our immunizations, we continue to make progress on immunizations. We're now up to 111,750 immunizations that have been provided to date, which is more than 21,000 dose increase from last week. This includes just over 18,000 individuals who received 2 doses of vaccine, so they're fully immunized. We've provided of these immunizations 7,500 AstraZeneca doses administered by family health teams in Simcoe County. And I'll be providing a broader report on immunizations a little bit later today in terms of what's coming. But in terms of coverage by different priority populations, 83% of adults here, 80 and older, have had a single dose of immunization, and 62% of those 75 to 79 have received a single dose. And about 90% of adults 70 and above either have received an immunization or they are booked to receive immunization. So we're making very good progress with regards to protecting those most vulnerable, people who are older. Same with those in long-term care facilities and retirement homes, with 96% and 97% respectively having received a first dose, and the great majority of those have also received a second dose as well. And the majority of the staff in those facilities have had actually 2 doses, and essential caregivers as well. We have a very high immunization rate with those facilities, 88% having received a single dose. 68% of hospital staff have received a single dose, and 71% of other healthcare workers have received a single dose of immunization. We look at our dashboard, which is our own framework, not the province's framework, pre-exists the province's framework. We remain in red status because a viral spread and containment is categorized as red. Laboratory testing is categorized as yellow due to an increase in percent positivity at 4.8%, up from 4.2% last week. Our healthcare system capacity is yellow status unchanged, and public health system capacity is red unchanged. We remain challenged in our ability to reach cases within a 24-hour period. At this point in time, we're down to 50.7%, whereas the week before it had been 72.6%. And this is due to the dramatic increase in both the cases, but also the complexity of cases and their contacts. Testing over the past week has gone up, 208 tests per 10,000 versus 108 per 10,000 the previous week. And as I've indicated, our percent positivity is up. And this is the 5th week in a row in which has been increasing. This is an indication of the prevalence of transmission in the community compared with the amount of testing that we're doing. And so an increase is always of concern. And it's similar to the provincial rate at 4.9%. The highest percent positivity we have is in young adults between 20 and 29 years of age at 7.1%. Lowest is in older adults, 70, 79 years of age, or actually those above 80 at 1.2%. Also, we have a higher percent positivity in the portions of Simcoe, Muskoka that have had the highest incidence of cases. So Bradford, West Gwillimbury, New Tecumseh, Innisfil, and Essa townships. So with regards to vaccination, we are making very good progress. We continue providing immunization in our community clinics 7 days a week and did so through holiday weekend. We have had a very high uptake of bookings. So we've had a very strong response from most of the populations of concern, certainly those based on age. And thus, we are completely booked up at our clinics up till April the 17th, but we do have appointments beyond that extending out to May the 14th. And we do continue to add more clinics in our schedules over time, booking out a month in advance. So I do encourage people to continue to have a look at our availability with regards to bookings. We now have 25 pharmacies that are offering AstraZeneca throughout Simcoe, Muskoka, with more coming. To those that are 55 years of age and older, people would have to book directly through these pharmacies in order to get your immunization there. And certainly I encourage people to take the first vaccine that they can get, no matter what type it is. If you qualify for it and you can get a booking for it, accept it because the prevalence of COVID-19 in our community is rising. The variants of concern are rising. Risk is rising. And this is one of the critical ways in which you can protect yourself, to get yourself immunized. Our family health teams, all 9 of them, have been receiving AstraZeneca vaccine. We now have 2 community health centers, one in Barrie and one in Wasaga Beach, that are receiving AstraZeneca vaccine, and they then can reach out to their patients in order to offer them bookings. And once again, this would be with the AstraZeneca vaccine, this would be for people that are 55 years of age and older. In terms of priority groups, along with the priority groups to date, we have new ones in keeping with us moving into phase 2 of the province's vaccination campaign. So people who are 60 years of age and older, effective at this time, can contact the province's booking system in order to get a booking into one of our community clinics. We are also providing vaccination. We're preparing to provide vaccination in so-called hotspots in Simcoe, Muskoka. So the province has identified areas of communities, neighborhoods where there's very high incidence of COVID-19 and a low prevalence of vaccination, and have designated those to be hotspots and have informed the health units in which those areas are located to find ways to immunize or offer immunization to people who are 50 years of age and older. And so we've been informed about that. And actually for us, the eastern portion of Bradford, West Gwillimbury is one of these locations. And so we are preparing to make available to that particular community immunization specific to this purpose. People who have high risk and very high risk, highest risk medical conditions are also eligible to receive immunization. And this is independent of age. And the province has determined the criteria for these conditions. And as a health unit, we've reached out to our local hospitals and primary care leads in order to have asked them to identify people with these medical conditions and to offer to them vaccines. So in some instances, the hospitals or primary care are providing the vaccine directly to these people. And when necessary, we would also be arranging for them to come to our community clinics. So such individuals will be contacted by their healthcare provider rather than asking these people to reach out to any particular booking process. And so the conditions that we're talking about are as follows: people who've had organ transplants, people with blood cell transplants, people with neurological conditions that impede their ability to breathe, people who've had kidney failure, and those who are immunosuppressed with chemotherapy, people with intellectual or developmental disabilities, people who are obese, and also essential caregivers for these individuals. So each one of these individuals would be allowed one essential caregiver to also be offered immunization. And as I said, the recruitment for this will take place from the attending healthcare practices, the hospitals, and the attending physicians for these individuals. So they'll reach out to people rather than having people call in. As I'd indicated before, we are seeing younger people being more severely impacted with COVID-19 at this time, and that it's showing up in terms of hospitalization and in particular admission to the intensive care unit, with younger people being in the intensive care unit than what we were seeing previously. I think it's very important for everybody to take this virus very seriously. We're now into a third wave, which may rival the second wave in terms of its ultimate impact. And therefore, there's a high degree of prevalence of COVID-19 circulating in our communities at this time, that people need to be aware of that and take precautions accordingly, exercise the stay-at-home advice, which may very well become an order shortly from the province, we shall see. And that means sticking to your immediate household for direct physical contact, not having other people over, with the exception of individuals who live alone, who could then be so associated with a single other household only. And when out, maintaining physical distance from other people, using a mask when in indoor public places and workplaces, monitoring yourself and isolating and seeking assessment and testing if you develop symptoms. And once again, for those, when you become eligible to receive immunization, to arrange to do so and accept the first vaccine that you can manage to get. So I have the following as media questions. Will you follow the lead of Peel, Toronto, and others and impose school closures or online schooling? What about vaccinating teachers sooner? Well, will that be happening? So we, at this time, will not be proceeding with an order to close our schools or commence only online learning. We are monitoring, I am monitoring the situation very closely. School is really very important for the emotional and physical well-being of children and for support for their families as well, to enable essential workers to be able to go to work. And if at all possible, we need to keep our schools in operation with in-school learning to address that critical need. And although as case counts go up in the community and transmission happens in the community, you're going to see more exposures in the school setting, we still have a very limited amount of transmission happening in the schools. And that, I think, speaks to the effectiveness of the control measures that are in schools, the screening that takes place, the use of masking, the cohorting. All of that is critical to maintain the school environment to be safe. So we are monitoring this. We're not in the same position as Peel or Toronto. Our case count, although it's gone up quite substantially, is still significantly less than the provincial rate and much less than the rate in Peel, Toronto, York, and other areas in the GTA. Therefore, we're not in a situation where there is such a high impact on the operations of schools that they would have to discontinue. Of course, things can change and can change quite rapidly during a wave in this pandemic. So we will monitor this very closely. With regards to the immunization of teachers, it is important that teachers be immunized. They are essential workers, and in phase 2 of the province's framework, they would be offered immunization early among essential workers. At this point in time, we are providing immunization to others in phase 2. So individuals who live in congregate settings, group homes, shelters, homeless shelters, corrections facilities, homes for the developmentally delayed, also providing vaccination to people with very high risk medical conditions who are immunosuppressed. So those individuals are at this point in time are following the provincial direction and providing immunization. And of course, we will monitor whatever changes of direction may come from the province with regards to the vaccination in general and specific to teachers. How do family doctors fit into the vaccination immunization rollout in Simcoe, Muskoka? Can they help with vaccine hesitancy? So I would say that we have primary care physicians as very much partners in our response in the provision of immunization. We have worked with the leadership of the 9 family health teams in Simcoe, Muskoka, in order to recruit primary care physicians and others, such as community pharmacists and paramedics and nursing staff from primary care and other facilities to help us in our community vaccination clinics. We have 13 community vaccination clinics, and many of the people working in those clinics are from those backgrounds. So family physicians are assisting in that way. Many of them have been receiving the AstraZeneca vaccine to provide to their patients through the 9 family health teams, through the community health centers that we've been providing AstraZeneca to. Some have received some Moderna vaccine as well to provide to vulnerable patients. And we're working closely with leadership in primary care and hospitals to identify patients at highest risk and high risk with medical conditions that require immunization at this time. So we do have family physicians very, very much involved in our campaign. We also have representation from primary care on our vaccination campaign advisory committee to help us with key decisions. With the spread of variants of concern among younger people, are there any plans to change the eligibility criteria to make vaccines available to everyone under the age of 16 rather than going over the age of 16 rather than going by age cohorts? So certainly there's great concern with regards to the need to protect essential workers. And as transmission goes up, that concern will rise. We've seen many outbreaks in workplace settings throughout the pandemic and are seeing it now as well with this third wave. So the protection of the younger people, whether it would be in the general community or whether in particular in essential work environments, is very important. It's one of the reasons why I have issued over time letters of instruction to our workplaces about all the control measures and the infection control practices that are needed to reduce transmission in those work environments and to protect workers, including younger people. But we do need to follow the province's sequence of immunization. We can't simply open it up to everybody at once. We don't have the volume of vaccine to be able to suddenly provide it to everybody at once. And even if we did have the volume of vaccine, although we have a very high capacity to provide immunization through our 13 community clinics and our pop-up clinics and our mobile teams, and through the provision in primary care and through community pharmacies, if everybody suddenly was eligible, then I think it would still take time to be able to work through immunizing everybody. This is something that takes time regardless. So it's important that we do it in a sequence that achieves the greatest good by focusing on those who are most vulnerable first, and then working our way down to others. Essential workers are higher priority than the general public. And I'm hopeful that we would get to them soon, although the province's framework actually places them to receive immunization in June. I'm hopeful that we can get there sooner, but we can't simply open it up across the board all at once. With the new data on efficacy of vaccines and with stepped up delivery schedules, will there be a change in the scheduling of second doses and an opportunity in Simcoe and Muskoka for those with a first dose to get their second shot closer to the time frame recommended by the pharmaceutical companies? So I would say we still have a limited supply of vaccine, and unless things change with procurement, and that rests with the federal government to achieve, and then things may very well change. But with the projections we've received so far, we see a steady state of vaccines through April and into May. So we do need to continue in the way we're doing now with working through the sequence of priority groups to get as many people with their first vaccination as possible, and otherwise having people wait as much as 16 weeks until they can get their second immunization. The National Advisory Committee on Immunization just put out a statement reaffirming this, but also indicating that when possible, people should be able to get their vaccination, their second dose sooner, not just the maximum of 16 weeks, but sooner if possible. So if we're able to move through the priority groups and get to everybody with their first dose expeditiously, then we will want to move on to getting everybody their second dose in as short a frame of time as possible. Ideally, we would shorten it up as much less than 16 weeks, but I think time will tell with regards to what we can actually achieve on that front. How will the hotspot vaccines be provided to those 50 plus? Why isn't Barrie a hotspot too? So as I'd indicated, an eastern portion of Bradford, West Gwillimbury has been identified as a hotspot on the basis of a very high prevalence incidence of COVID-19 and a low vaccination coverage. And for that reason, we are now identifying, working out a plan to be able to bring immunizations specifically to that neighborhood for those that are 50 and above. We've identified other areas throughout Simcoe, Muskoka that have a high incidence, and it's true that certain neighborhoods in Barrie have a high incidence. And we do communicate with the province about the needs elsewhere in our district, asking for more immunization, more vaccine if we can get it. And we'll continue that process. Otherwise, we will do all that we can to optimize vaccine availability with the priority groups that are identified with the province, and making it as easy as possible for people to access vaccine by providing it broadly in the many venues that I've already described. Are you concerned about the businesses that have been defying the orders by staying open? Are you worried about pandemic fatigue by both businesses and people? So I would readily acknowledge that pandemic fatigue exists, that any of us, all of us, feel fatigued by this pandemic. It has been going on for over a year. It has taken a very serious toll on our collective well-being. Certainly those who've been cases and those who've passed away have suffered the most, but many others have had a loss of access to healthcare services, and all of us have had our social lives impacted on. Our ability to have close contact with people we care about has been severely hampered for many weeks at a time throughout the pandemic. And so I would really acknowledge that a pandemic fatigue exists. It certainly had a major severe impact on businesses and people's livelihoods and people's ability to make ends meet. So I would acknowledge all of that. And I would also acknowledge we've had some complaints about certain businesses that are remaining open despite the shutdown. And our approach in those situations is to determine what agency, what enforcement body should approach those businesses. It's between ourselves, bylaw officers, and police. And when it's us as public health approaching these businesses, that we take an education approach first, followed by an enforcement approach. And in some instances, we've learned that the businesses in question simply didn't understand that the shutdown order was in place and applied to them. So what do you think about the idea of limiting big box stores to selling only groceries and pharmacy items, blocking access to other products? And I would imagine, I've not been able to follow the Premier's announcement. It's possible that this information is already out. But if in fact it's true that there will be a closure of on-site access to retail apart from groceries and pharmacy items, and that other products would have to be provided curbside, I would agree that it should apply in all settings, including the big box stores, in order to be maximally protective of the public, reducing the kind of movement and mingling that can result in transmission, and also there have been a lot of concerns raised about fairness among retailers with regards to a common approach to the restrictions. So at this point, I would be happy to take questions.
Great. Thank you so much, Dr. Gardner. So we'll now take some questions from the media. Can we start with James Bowler from Cogeco? Do you have a question for Dr. Gardner? No questions. Okay, thank you. Mary Beth Hartill from muskokaregion.com.
No, I'm actually quite good. Thank you.
Great. Thanks so much, Mary Beth. Dawn Huddlestone from the Huntsville Doppler.
Nothing for me today either. Thank you.
Thank you. Chris Simon from the Barrie Advance.
Sure, I'll ask a couple. Dr. Gardner, can you explain where the health unit is seeing the most amount of spread right now within the community?
So we are still seeing household clusters as being very dominant. It's very much an interplay between household clusters and workplace settings as being dominant areas for transmission. We've had some other long-term care facilities that have been identified as outbreaks, but they've been extremely limited in their size, usually a single staff person. So that's because of the vaccines, the high vaccination rate. Coverage in those settings. So it's still the pattern of these household clusters in workplaces.
Okay. I don't know if you saw the social media statement from Mayor Jeff Lehman, but he talked about how he thought that there was a need to much more directly target workplaces, focus on getting essential workers prioritized sooner than mid-May. Did you see it, and what do you think of that general sentiment about maybe how we approach the pandemic going forward?
So I didn't actually see that particular statement, but I've certainly heard that sentiment expressed before. I would say that I sympathize with the need to protect workers, but we do need to protect those who are most vulnerable first. We've had, of course, the great benefit of having protected those in long-term care and retirement homes, and we see the impact of that. We now have patients who are very vulnerable because of their medical conditions who require protection, as well as people who live in group homes who've been very much a part of outbreaks all the way through, in particular, the second wave. We really need to work through those who are most vulnerable before we can get to others. So, if you simply look at this in terms of a need, one can always say that those who are essential workers have a high need to receive this. But when you don't have an inexhaustible supply of something, you really need to ask yourself, who needs it first now?
If I may, though, just to follow up, is there not something to be said, though, for the idea of vaccinating or shutting down businesses that are proving to be hot spots and killing the spread of the virus there?
I have no doubt that it will achieve great benefit when we can get to that. It will take us time to do that. And if we were to, say, discontinue vaccinating those who are most vulnerable right now and shift all of our vaccine to essential workers, we would still take a long time to get through them because they're a very large group of people that we're talking about.
Thank you very much.
You're welcome.
Brett Glover, do you have a question for Dr. Gardner?
Well, thank you very much. Yes, I do. Actually, first, I'd like to point out to anybody who hasn't noticed yet, the Premier's speech was delayed till 2:30, so we're not missing anything just yet. Dr. Tu, I want to circle back to one of my questions that I asked last week regarding how many of the recent victims of COVID were vaccinated before their deaths. Were you able to find that out?
It was. So of the people that I spoke of today, none of them had been immunized. And then last week, there were 3 individuals who passed away. 2 had been immunized, 2 had not been immunized. 1 had been immunized, but that was at about the time that they were emerging with symptoms. And so it was too late.
Thank you for checking up on that. And maybe you could let us know how much of this third wave is potentially a result of insufficient restrictions on the part of legislators, and how much of this is not folks abiding by those restrictions.
I think that that's a very difficult thing to tease apart. I would say back when we first came out of the stay-at-home order, I immediately identified publicly my concern that the province was taking a risk for the potential of a third wave, that we were losing an important control measure. The stay-at-home order was a very, to me, effective tool, a very clear message to the public about what was needed, a very simple message. At that time, I was concerned about the emerging variants of concern, and in particular, how prevalent they had been here because of the large outbreaks that we had. So I felt back then it was important to maintain the control measures that had been taken away. I'm happy that they're back. They're needed now more than ever. When it comes to people's individual behavior, to a large degree, that's driven by leadership, by the kind of restrictions and expectations of leaders of the province. So I think that although there are always people who won't abide by such requirements, the great majority of people do abide by them. They want to follow what is needed, what is expected of them, what is required of them.
Thank you.
Welcome.
Dana Goldfinger from Global News. Do you have a question for Dr. Gardner?
Yes, I have a question. My question is regarding the priority neighborhood that was identified yesterday by the Ontario government. Why was that one chosen in East Bradford area, and why weren't other sort of areas in the region where there's a lot of COVID spreading identified?
It was based on epidemiology. It was based on the incidence of COVID-19 in that neighborhood and hospitalization rate, mortality rate. And also we found vaccination coverage is very low in that neighborhood as well. But we've identified other neighborhoods with similar problems elsewhere in southern Simcoe, including in Barrie. So as a health unit, we're making the case it would be beneficial to be able to provide the same kind of service, the same kind of protection in those neighborhoods. We'll continue that dialogue with the province.
Okay, thank you. And then my follow-up question is, do you know what percentage of people who were in groups identified who in phase 1 were vaccinated? So, for example, 65 plus for the AstraZeneca vaccine, and then 80 plus as well.
So we do have quite a bit of information on our website about vaccination coverage rates for subpopulations. So certainly, feel free to have a look at that. It's under health stats for COVID-19. There's a section on immunization, but I've provided some of that data verbally about age groups. For example, those that are 80 and above, 83% of them have had their first dose of immunization. I indicated that hospital staff, 68% have had their first immunization. The other healthcare workers, 71%. There's a large category called other priority groups. There are a total of 1,500 people. And at this point, 1,500 have received immunization, but we don't have a denominator for that group. Therefore, I wasn't able to give a percentage coverage for that. Would that be meeting your needs, or are you seeking something more granular?
Yeah, I think that covers it. Do you know what percentage of the population in Simcoe, Muskoka has been vaccinated at this point?
If you do the math, it looks like about 17% not 17% of the population has been immunized, but there have been 17 doses administered per 100 people. because these are vaccines that require 2 doses, that's not the same thing as percent coverage. But we do have, we've got the total coverage for 1 and 2 doses for people also up on our website. So a total of 91,217 people have received 1 dose, and a total of 18,366 people have received 2 doses. And there's just under 600,000 people who live here. So you could do the math. If you like, I could have that math done and provide that figure to you.
Yeah, sure, that would be great. It sounds like about 17%, if I'm understanding correctly.
I would have to do the math to be
First
sure of
dose.
that figure for you.
Okay, thanks. I'll follow up on that.
Mike Arcelides from CTV.
Hello.
Huh?
Doctor, how are people getting this right now? Is the main concern right now going into a Walmart? Is it going into a grocery store? Or is this simply people saying, to hell with this, we're going to have a party at my house, come on over?
For the most part, it's household, family, friends, networks of that, social networks that are transmitting it. And then to a lesser degree, but also important, in work environments and the interplay between the two, where a person may have gotten it through the social network and then transmit it in the work environment. So the idea that you're going to get it through random, brief contact with a person in the community is far less likely than through those other means.
So where would these workplaces be? Would they be at a Honda plant, for instance, or would it be going to Toronto and having to work in an area where it is a hot spot? And unbeknownst to you, you're bringing it to your household, you're getting your partner sick, and then they end up in the ICU.
Well, certainly a good portion of our population, particularly in South Simcoe, work out of district, and a significant number of our cases have arisen from outbreaks out of our district for such people. We do have fairly detailed information on our website about the nature of the locations involved, the types of locations that are involved in outbreaks. And so by all means, I'd encourage people to have a look at that to get a more detailed sense of it.
But with regard to the variant, right? Because this is, as your colleague, Dr. Kurji, at one point said, it's 80 to 100% transmissible when it's a close contact, whereas the wild strain used to be about 20, 25%. So is it conceivable, when you're getting people outside within close proximity, not wearing a mask, that it is transmissible? I understand there was evidence in Alberta that there was airborne transmissibility outside. Are you seeing that, hearing that? Or is this strictly relaxing of restrictions on a personal level in the household and in the workplace setting in that lunchroom?
Well, one thing we've not seen is an increase in the number of community cases. So that percentage has remained stable, around 20% or so. And community cases really means we don't know, which could very well come down to the kind of thing that you're talking about through chance encounter in the community, perhaps in a retail location or other. And it's far more likely to transmit in an indoor environment than an outdoor environment. So if that has not changed, that percentage has not changed. I think if it's more transmissible overall, maybe you could get it by that kind of chance encounter, but the means that were more transmissible before remain such. So household, family, extended family and friend networks, or lapses in the work environment are going to be still the predominant means by which people are going to get this.
Are you concerned with the migration of those from the south north? Because as another colleague from Alliston said the other day, he was driving around delivering life-saving equipment, shuttling it from hospital to hospital, and he's seeing every parking lot and mall full over the long weekend. And a lot of license plates, if that's going to be your indicator, are not from this neck of the woods.
Well, I've always been concerned about movement. Population movement has been an important dynamic in the pandemic, one of the ways in which transmission happens. We know there's a correlation between the amount of movement that people do both within their community, but between communities, and transmission of COVID-19. So to me, it's important that we have this across the board shutdown that's now in place so that there isn't a difference in what's open between districts. And that should help discourage movement, at least to some degree.
If you're going to be someone from Toronto or Mississauga or wherever, you're going to say, you know what, I'm going to go up to Barrie. I'm going to hang out at the Park Place because it's better and probably safer than going to Square One or whatever. That's probably what I would do if I were in that position and didn't add reckless abandon. Is there any indication that that is the case here, where from an epidemiological standpoint, we're tracing things back to other people from other health units?
For the most part, we're tracing it among networks within our communities. So, as I said before, family clusterings, household clusterings, and in the work environment, there certainly has been some transmission in work environments that exist out of our territory for people who live here but go elsewhere to work. So that's certainly been part of the pattern. As I indicated, there is this unknown fraction of our cases that we call community transmission, where I suppose what you're talking about could be possible. We simply can't know.
And just those deaths in the past 24 hours, do you have specifics on those individuals? Were those for our broadcast tonight at 6 o'clock?
So that was over the last week.
So there were, what was it, seven individuals over the last week, but 2 in the past 24 hours, right? Because we went from 203 to 205 deaths as of today. Who were those specific individuals? Do you have that at your disposal there?
So I normally don't give out detailed individuals in order to protect detailed information on individuals in order to protect privacy.
Was that the man 65 to 79, the woman 40? That's what I'm speaking at here, because we have that information provided to us.
I wouldn't be providing that kind of information because it's too detailed, potential to identify individuals.
Okay. Thank you.
You're welcome.
Thank you. And Mark Claremont from Muskoka Today.
Yes, Doctor, just quickly there, regarding today's announcement there, how comfortable are you, or how do you feel, I should say, about it coming on the eve of the spring break?
That's a good question. I'm glad we need these restrictions to control this wave and to get us in a better position so that we can immunize people and protect people and bring the pandemic under control. And there is the potential with a break for transmission in the home environment. We know that at the Christmas break, there was a substantial increase in transmission to children. So in some ways, the school environment's safer than out in the community and in the home environment when it comes to COVID-19. So having a break could be a challenge. The fact that the shutdown is in place would, I think, help to reduce that risk.
Would you like to have seen it sooner?
Well, as I had indicated back in February, I felt that it was very much a risk on the part of the province to come out of the shutdown and the stay-at-home order at that time.
Okay, thanks.
You're welcome. We have time for one more question. Brad Pritchard.
Oh, hi, Dr. Gardner. I just have a question regarding, it's a resident who lives in our area, and she has 3 children who are in their late teens, early 20s. One of her daughters has severe autism, and the other 2 children are her caregivers, and they're being paid through some provincial program. Now, you mentioned earlier that for the next phase of the rollout, that people with conditions like that can have one essential caregiver vaccinated. So I'm assuming that's the case in this scenario. But would there be exceptions made for the second individual?
My understanding is for individuals who have highest risk or high risk conditions as identified by the province, which would include those who are developmentally delayed, who are adults. Remember, this is not a vaccine approved. These aren't approved for children. But anyway, they would be allowed to have one essential caregiver also immunized.
Okay, so one of the siblings, based on what you know, one would qualify, but then the other one would have to wait until further along in the rollout based on what you see?
I can't really comment on an individual case, but if you're talking about are in this situation for the residents in for the individuals with the condition, they would have to be adults to receive immunization, and the essential caregiver to receive immunization would have to be an adult as well. Just to be clear.
Yes, they're all adults, like university age, as far as I know. Okay, and just with the daughter that has the severe autism, just bringing her into like a large mass vaccination clinic, like an arena, would not be an ideal situation for her. Lots of loud noises and people and things like that. So she just wants to know if her daughter would be able to get the vaccine in another way, like through a drive-through clinic or like privately through a family physician. Can you clarify that?
So we are working with our hospitals and primary care leads about how they can reach out to these individuals and notify them that they would be able to receive immunization. We are giving vaccine to these facilities and leads to immunize in a location that they would choose. It would make most sense for them. And we're happy to also take them at our vaccination clinics when appropriate.
Okay, thank you.
Welcome.
Dr. Gardner, I am mindful of the time. I do have the request for one final question.
Mm-hmm.
Okay. Angle.
Thank you so much. Dr. Gardner, my question is about people sort of using sort of loopholes. I remember one time you talked about regulations versus recommendations. And I wondered if you've seen people maybe not following recommendations as much because they're not enforceable as maybe say in the first wave when people were being careful and walking far apart from each other and staying home more.
So I would say, to me, the whole idea of not having people over is a critical one. And I've seen some data that shows that that's one that people have trouble with. They have much better compliance with hand washing or with mask use. But when it comes to the restriction on having people over or being in close proximity to people, they have a harder time with that. And that is the kind of situation that's actually high risk as well, where we've seen transmission with clusters of people who are socially associated with each other. I think that would be a good example. And with a stay-at-home order, it becomes, in fact, the law that people stick to their immediate household for close contact. And it makes it a very simple message then as well. I think that has a value for us in order to get across something that people would understand.
Thank you very much.
You're welcome.
Thank you so much, Dr. Gardner, and thank you everyone for joining us today.
Take care.
Goodbye, everybody.